Good afternoon, thank you for joining us this afternoon. The very first item on our work session is a proclamation for National Surveyors Week. And we have Bob Anzoff, who is the chair of the Maryland Society of Surveyors, here with us. Take a step forward. Oh, for you and I, Mary Lou, you should use that thing. Hang on a second, you know, I got my glasses.
No big deal.
There you go.
Oh, everybody.
That's how it works.
There you go.
That's good, okay, got it.
Thank you. Thank you so much.
Well, I'm gonna read this. Hang on.
Oh, yeah.
Now you gotta put that on.
Okay, so, hands off, tell me what.
Knew my dad was a
Okay.
passenger.
All right.
He spent 33 years, my dad spent 33 years working for the state and corrections, and almost as long retired. So,
Your dad loved and hated you. Then you get it on.
but that's the fate of a politician, I'm afraid.
I understand, I understand. I worked for him for, 10 years, I guess, before I transferred down to the shore. So, yeah, like I said, he loved and hated me on any given day.
They all claimed that he was hard but fair, so.
There's no doubt, he was. There was times that, you know, like my daddy, I mean, there was times I deserved it. Times I didn't, but there were times I did.
No.
All right, so the proclamation is National Surveyors Week, March 15th to the 21st, 2020. Whereas National Surveyors Week was proclaimed nationally by the 40th President of the United States, Ronald Reagan, on February 13th, 1984. And whereas National Surveyors Week is recognized every year, starting the third Sunday in March. And whereas the goal of National Surveyors Week is to educate the public on the importance of surveying, which has been a part of the advancement of civilization since the beginning of recorded history. And whereas the Bureau of Labor and Statistics estimates there are approximately 43,400 surveyors in the United States. And whereas surveyors are skilled and familiar in several fields, including geometry, trigonometry, regression analysis, physics, engineering, meteorology, programming languages, and the law. And whereas surveying is used in transport, communications, mapping, construction, and the definition of legal boundaries for land ownership. Now therefore, we, the mayor and council of the city of Hagerstown, Maryland, do hereby proclaim that the March 15th to the 21st, 2020 is National Surveyors Week, and encourage the citizens of Hagerstown to recognize professional surveyors and the important work they do for our community. And that is for you. Eric, you want to get one? Glasses off.
Back in uniform. Thank you.
Want to say anything?
Just on behalf of the, lights on. On behalf of the Maryland Society of Surveyors, of which I'm Public Relations Committee Chair, and also on behalf of the National Society of Professional Surveyors, I'm a former administrator and a member. I thank the mayor, Mr. Mayor, and the council for this proclamation and also for promoting us. Quite often we're first in and last out, and sometimes even after last out, return for the renovations and for refinancing and all sorts of other things. So we're there all the time, but we're practically invisible. Nobody sees us.
It's true.
So this will help that. Thank you so much.
Thank you. All right, needle exchange program and COVID-19 update. I went to the grocery store today, Earl, and there was plenty of toilet paper. I was happy.
That's good to know.
There's none at Sam's Club though, because that's where I went.
That's where you went, so you can probably go with the mayor, go and buy some for you.
Earl.
All right, well, thank you for for having us here today. Since we have two important topics, I want to be respectful of your time. So I think everyone should have a presentation in front of them.
We're arguing about sitting here.
Oh, okay, all good. So, needles, so public health crises. When I did this presentation a number of weeks ago, we only really had one public health crisis, but now we have two, so we'll talk about the first one. So, obviously, due to the opiate epidemic, one of the things that we are seeing, when I say we nationally, we are seeing is an increase in infectious diseases, namely HIV and hepatitis. We're also seeing sexually transmitted diseases, sexually transmitted infections, whichever one you want to call it, exponentially rise also. A lot of it fueled by the drug epidemic, by the opiate epidemic. The other here, for us in particular, is that we have a lot of high rates of human trafficking, sex for drugs, like the whole nine. So we're looking at twofold. We're looking at the opiate epidemic, and we're also looking at an epidemic of the spread of associated infectious diseases, as I spoke about. So nationally, currently, if you look at hepatitis C, in particular, hepatitis C virus rose about 3.5-fold from 2010 to 2016. The majority, overwhelmingly, the majority of new hepatitis C infections are due to IV drug use. Over about 2,500 new HIV infections occur each year, specifically among individuals who inject drugs. There have been significant increases in MRSA because of abscesses and other infections associated with injecting, and also, as I mentioned, sexually transmitted infections. And then, of course, we have continued high numbers and issues with actual overdose deaths and the associated issues with that. The next slide is kind of hard to read for us, but the bottom line is that the CDC did a vulnerability assessment, and everything in either green or pink on this map are areas that are at increased risk for outbreaks of namely HIV and hepatitis, but other infectious diseases. If you look where Maryland is, you see a little pink. That actually is Berkeley and Morgan County, correct? West Virginia, which is basically directly across the border from us. The pink counties or jurisdictions are the top 220 counties in this vulnerability assessment that were at risk for an exponential rise in cases, which would lead to an outbreak of HIV specifically, but also hepatitis C. The next slide, the first bullet, Scott County, Indiana. Small county in Indiana. Now Vice President Pence was governor of Indiana during that time. From November of 2014 to October of 2015, there were 181 new cases of HIV in this small, like 5,000, 6,000 person community. In the preceding 10 years, they had 5 cases. So 10 years, they had 5 cases. All of a sudden, in less than a year, they had 181. What tipped health officials off was a significant rise in hepatitis. They called the state health department, CDC in, did a lot of investigation, came back to obviously high hepatitis C in particular cases, but also high HIV cases. Cabell County, West Virginia, and this was a couple weeks ago, they may have had a couple more since, but since January of 2018, they've had 80 new cases. Hamilton County, Ohio, you can see 50 cases in a year time frame, and also in Lowell and Lawrence, Massachusetts, in a 3-year period, they had 129 new cases of HIV. So harm reduction, what is it? It's evidence-based. I think in particular, we have to keep in mind that what we do as health professionals as it relates to addiction is we view addiction as a disease. We don't view addiction as a moral imperfection or a moral failure, and we also look at the evidence. What does science say? What do the facts say? What does the evidence say? So harm reduction really is a set of strategies looking at negative behaviors and how can we get individuals along a path of positive decision-making. Syringe service programs are a component of harm reduction, obviously sort of the signature component of that. It's a CDC best practice. They recommend harm reduction in syringe service programs. CDC has a high five, they call it, 5 strategies that you get the biggest bang for the buck as it relates to health. Syringe service programs is one of those. Syringe service programs build a bridge to other health services. So when you look at harm reduction in syringe services, first and foremost, it's not necessarily an addiction-oriented program. It is a disease prevention program. Secondary to that, and probably equally as important, is the component of getting individuals into treatment. Syringe service programs, and this is really, really critical, they meet people where they are to facilitate engagement. We'll get to that a little bit later. 44 states and DC have approved syringe service programs currently. The next slide on the deck is Maryland, and you can see that currently there are 7 programs operating across Maryland. There are 4 in capacity building phase, and also to note at the bottom, it's small in smaller print, Berkeley, Morgan, and Jefferson County in West Virginia also have some sort of semblance of syringe services. Some of the programs are bigger, some are smaller. Components of our program, obviously education about overdose prevention, safer injection practices, referral to treatment, substance use treatment, referral to medical, mental health, and other social services. Of course, infectious disease testing, counseling, treatment, and referral. Syringe services, including clean syringes and other equipment, naloxone, safe disposal containers. Our program has about, and it may have changed, these are numbers from a couple weeks ago, but about 455 participants thus far since we started the program in 2017. We've referred roughly 203 individuals to substance use disorder treatment. A little over 4,000 naloxone distribution kits and education have been given out. Just under 140,000 syringes distributed, and also involved in community outreach and education with various churches, community organizations, other agencies. So what does the science say? And this is increasingly important, as I mentioned. We don't take this thing and what we do lightly. Again, we work on evidence base, we work on facts, we work on what the evidence shows us. So from a scientific perspective, syringe services increase entry into substance use disorder treatment. So studies prove and have proven over 35 years of scientific evidence and research that individuals that are involved in harm reduction or syringe service programs are 5 times likely to enter treatment and about 3 times more likely to cease at some point along that paradigm their injecting practices. Also, from a scientific perspective, syringe services and harm reduction programs reduce the number of new HIV and hepatitis cases by about 50% for individuals who are involved in these programs. Baltimore in particular, over a 10-year period, had just under 1,900 new cases averted of HIV. That was about a $43 million savings and about a $32 million one-year return on investment, because a lot of these individuals, unfortunately, are basically on Medicaid or uninsured that would be involved in charity care.
How do you figure that you 1,900 people
They did modeling.
reverted? And
They did modeling over the years and looked at, I don't know how they did it, the intimate details of it, but in essence, they modeled and did a modeling program, looked at previous new cases since or before the program started, and modeled throughout the years what the projected estimate would be. So from a dollar savings, if you're looking at an individual with HIV, you're looking at about $400,000 worth of treatment. If you're looking at an individual with hepatitis C, that's a typo there, it's about $100,000 to $300,000, and that's not including if the individual would require and have the liver transplant. The cost of curing hepatitis C, which is a one-time deal, is roughly $55,000 to $95,000, and the cost of a clean sterile syringe is about 10 cents. So the intervention model, and I think that this is really, really important, if not the most important aspect of this. Harm reduction is not a sort of willy-nilly, we're gonna get supplies and we're gonna have this warehouse and, people can walk in and, hey, what do you need today? And, we'll fill up your quote-unquote drug starter kit and send you on your way. It's based off of an internationally utilized and internationally renowned model called the trans-theoretical model or the stages of change. It was created, sort of co-created by Carlo Di Clemente, who's PhD, internationally renowned, and works out of UMBC. So he's in our backyard. We have done work with him on many occasions. The model basically meets people where they are. And the premise of addiction is meeting people where they are. Everybody presents to you in different manners. We run into some people who are ready to roll. This sucks, I'm tired of this, I need to get into treatment. We run into the vast majority of individuals who are not necessarily, they may have thought about it, but they're not really ready to get into treatment yet. So this is really a trust and rapport building program. It offers support, it builds on the possibility of change. And if you flip the next, that has the stages. Pre-contemplation, contemplation, preparedness, action, and maintenance. Most of the individuals that we run into in the harm reduction program are in the pre-contemplation or contemplation phase. Maybe they've experienced an overdose, maybe they haven't. Maybe they've thought about it, maybe they haven't. But they have not been in a situation, at least at the present, that we're dealing with them, where they are actually preparing to go into treatment. Our job is to get them, build that trust, build that rapport, maybe one time, maybe 20 times a week, maybe 10 times, but you're building that rapport with the individual so that at some point, they could come in and say, yeah, overdosed last night, this sucks, or lost my kid yesterday, or whatever it may be, and I'm ready. Like, can you help me along in this process? We move them along to the preparation stage, hopefully get them to the action stage where they actually enter treatment and into the maintenance stage where the individual is in recovery and hopefully maintaining their sobriety. But this is critically important because I think a lot of individuals out there think that this is a program that there's no rhyme to the reason. There is a rhyme to the reason, and it's based off of this theory and it's based off of this proven model that is sort of like the foundation of addiction work in general. I don't want to go through everything in the interest of time, but I've also included some appendices, some additional information. One of the things that I do want to highlight, though, is if you go back, you'll see one that says, it's called SEEDS, but it is statewide SEEDS program, statewide ethnographic assessment of drug use and services. This was a study that we participated in with Johns Hopkins, mainly as the principal investigators, but also the University of Maryland and the Maryland Department of Health, where they came out and conducted, did surveys and conducted focus groups with stakeholders and with individuals who were active in addiction, really looking at, to analyze patterns. What do we see in Western Maryland, historically, currently, describe sort of the local service capacity. Are there any gaps that may need to be filled? And assess the potential for the capacity of harm reduction expansion. Interestingly, if you look at the next slide, the health department was recognized for playing an important role in this process, trying to bring drug use and drug services sort of like out of the shadows, so to speak, in a positive way, and really attacking the stigma. We were also highlighted for our efforts to incorporate voices of the people, which basically means individuals who are in recovery and honestly some who are still in active drug addiction or drug usage were involved in program design. So it really isn't us sitting behind a desk thinking that we know everything and this is what the community needs. It's the community itself providing directive and guidance for the implementation of the program. And that also crisis and detox service were identified as still critical for getting people into treatment. So with that, I want to stop because I know you probably have questions. But in essence, the program is aimed at meeting people where they are. I can't say that enough because I know that, you know, some of the critics of the program are like, well, you know, I know people that went there or whatever it may be, and they didn't do this or they didn't do that. Well, it's predicated on a model. We don't jump on individuals right as they come through the door. Hey, got to get you into treatment, like what's going on? It's really a sort of like covert assessment of where that person is and where they say they are and guiding them along that process. Anything to add? I was kind of rambling in the interest of time, but wanted to get through as much as possible.
So I think one of the things that probably precipitated the presentation tonight was the recent press articles about the packet that our delegate picked up. And that's the thing that people I talk to question is, and I don't know, I was gonna go get one, but I didn't. But what is in a packet? If I walked into the health department and said, I want a packet. Now, and I'll preface that with, a lot of the people I talk to, they understand the need for a needle exchange. They understand the theory behind this. But the objection was that it sounded like this is like an instructional packet on how do you shoot up. What's the best way to shoot up? Here's the paraphernalia that goes along with it. And people are asking, why are you using my tax dollars to train people how to become an addict?
Well,
They already are an addict.
Well, but.
So that is-
That's what I want to add. What is in the
So
packet?
this program-
What are we
Well, there
looking
isn't
at?
a
And
packet.
yeah, there
I
is.
mean, there's a-
Well, let me go through this first and then I'll kick it over. But I want to, just to sort of clarify, individuals that we are dealing with in this program are individuals who have severe, I don't know necessarily the word, but severe addiction. These aren't individuals that just woke up one day and said, hey, I'm going to go get a starter kit from the health department. I think being a heroin addict would be a good idea. These are individuals that unfortunately have been in addiction for a while. And so the concept of us giving out drug starter kits is not accurate. Addiction doesn't work that way. It just doesn't work that way. These are individuals that have been at it for a while, for the most part, and they just didn't wake up one day and say, yeah, you know, I want to kind of get into this, and they give kits out at the health department.
So I think what he's trying to get at is, you say it's not a packet, what can you get?
Yeah.
So David's gonna talk about that, but they also are trained, like, individuals who, well, they all are trained through the Harm Reduction Coalition in Baltimore, because I could never walk in that room and know what to do. Like, I have no idea what's in there. I wouldn't know needle gauges or anything like that. And a lot of times, the participants guide our staff. But David, you
So,
can
yeah, so
talk
take us-
about what.
So some of the things that are, everything that we give out has a specific reason behind it. So one thing people say, well, why are you giving out different size syringes? What's the difference between a 29 gauge, a 31 gauge, a 30 gauge? And that is depending on the person, their skin types, their vein, it may take a different type of a syringe to actually access the vein. The other thing is that people don't know what they're using. We've met individuals, more so women, who that people are injecting them with syringes, which means that person has control over them. So we talk to them, why are you using that type of a syringe versus a different type? Cotton, people are using cigarette butts to inject, so that nicotine that's in that actually will infect them. We give out what's called a mixing kit, and I think someone referred to it as a cooker. They use bottle caps. If you're using bottle caps from sodas and other types of things, again, we're trying to lower the risk of infections. Tourniquets, people were asking, well, why would you give someone a tourniquet? If they're using a belt or other items and they're using that with the next person, you use a syringe, you may bleed, then that tourniquet or belt has blood on it. you're now using that with the person who's sitting beside you. So those are some of the things that people can get. I invite anyone, please come out and see the clinic for yourself. It's more easy to explain when you're there and you can actually say, well, what's this, why are you using that, as opposed to just what you may have seen on TV or see on YouTube. Does that help?
Yeah, no, that helps, because that was the, I think that was the perception that a lot of people got from the Herald Mail article, was that you can walk in off the street and you can get a drug starter kit.
Yep.
Yes.
That's what it
But
was
you get a
referred to
cooker.
as.
Right.
Plus you get a cooker.
And it wasn't they're not kits, they're not, everything has its separate bins, so when they come in there, they'll say, I need this, I need this, I need this.
And the whole time that that's happening, we're having a dialogue with them, like Roll was saying, while they're asking for this syringe, then I can say, well, how are you doing, how's your veins? And as I get to continue to meet with individuals, I learn like about their kids. You have kids, how are things going with your kids? What's going on, are you interested in treatment today? It's not just to come in, get your syringes and leave. And there are a lot of people that do come in and are like, would you leave me alone? And I'm like, well, I will, but you know, I care enough about you to answer how you're doing today.
Yeah, it's not a commissary.
Yeah.
It's a, you know, it's the first step for someone taking personal responsibility for their, you know, their addiction and their disease. So, I mean, I support everything that you do. I admire it, and I know that it's hard work,
Thank you.
so.
I think it's a shame you had to do this because of the fear mongering that was done on
Well, we
camera
did
at
this
the
because you
county.
requested it.
No, well, they have to correct the ridiculous,
Just teasing.
untrue facts that were given to the county commissioner. It's a shame. But, you know,
But it's an
people,
educational opportunity.
people
so
who have a
that's the
substance
silver
use
lining.
disorder don't want to die. That's the reality of it. People think they want to die. They don't want to die, but they're struggling. So what you guys do is help to keep them alive, and I appreciate that.
Earl, can you?
One thing
can
is
you-
absolutely positive. Nobody who's never put a needle in their arm comes to you guys and say, geez, I'm really
Yeah.
interested in starting to shoot up.
I've heard about
That's
it.
what
It's
we
a
all
really
think.
cool
I mean,
concept.
yeah, I-
He has one more thing to add.
Yeah, I don't let doctors put a needle in my arm. It doesn't matter.
And I'll be real brief, but I've been in the field of chemical dependency treatment since 1989. So pretty old, right? And I can say that at this point, I am seeing people that we've never seen come to the health department, which means now I have an opportunity to say, what can we do for you? We had a lot of people court-ordered to come see people like me, and they would just sit there and be extremely angry and leave, and nothing would change. Since I've been doing this, and it was hard because I come from a recovery background myself, so I couldn't wrap my head around why would we give this to people. But today I can say that working with individuals on this level through this type of intervention, I've seen more people get into treatment and be successful at it than from 1989 to 2020 that I've seen people that I've met in the treatment from the jail to the health department. So it's really a phenomenal way of meeting people that's so different than what we've tried in the past. So thank you for giving us the opportunity to do this type of work.
Kristen?
I have a couple of questions, and I'll preface this by saying, you know, when you have this conversation with a seventh grader who's doing this as sort of like a school report, you have a much greater dialogue than you would ever think that you would have your seventh grader be aware of. And so, you know, we tried to sort of facilitate a conversation between us as it related to sort of what maybe we were comfortable as citizens with accepting to address the issue that clearly exists, and what degree we were uncomfortable as citizens to accept as an impact to other citizens that may be affected, you know, negatively. And so, you know, when you had that conversation, and there's 3 pages on here that relate to that, and to me, I'm more of a mathematics guy. There are one statement here, components of Washington County Harm Reduction Program, where it says safe disposal containers. And so that's the item that she's actually focused on, and more so with, you know, when you do creek cleanups, you know, 10 years ago, we didn't think about that
Right.
as quickly and diligently and cautiously, you know, as we do when we invest in those opportunities to improve the conditions of the community. You know, we didn't have folks, and Lou can correct me if I'm wrong, but we certainly didn't have folks in neighborhoods that would come in and say, hey, you know, or get emails that said, hey, you know, they're sort of, you know, littered around my neighborhood. And I know that Emily has cited, look, if you call this entity, they'll come in and they'll check. And, you know, and let's just be honest, we as council members are not going out and validating that there's 3 or 5 or 7 or 1 or none, you know, at a place that a person asked about. And so you have the next page here, Washington County Harm Reduction Program data. It says number of participants, 455. Is that since it has
Yes.
started?
In 2017.
So we'll just say,
But we haven't, we started the actual harm reduction program in 2017, but it was almost a year, literally a year to the day almost, before we started giving out syringes. So we went the first year, there was no syringe distribution.
so, and then I see a number of syringes distributed, 140,000, just to even it. And I guess I'm trying to figure out, does that mean that you have provided 140,000 syringes to 450 participants?
Not necessarily. I don't want to misspeak, but not necessarily, correct? Yes.
Yeah, because I guess that's what I'm trying to figure out, because that's a little over 300 needles per person over a 2.5, 3 year period, which seems like a small segment of population for a very large volume of needles. And when we get folks that come in or that send us emails and say, hey, you know, here is an experience we're having within our neighborhood, within places we go, within things we're doing where we now see this and we did not before, I think that as elected officials representing those citizens, we have to question with some, you know, justification, if there's 140,000 needles going out, what's the percentage of those coming back in? Because if it's, you know, we get 40% back in, then that means that those 60% are definitely ending up somewhere, you know, else. And so
Correct.
one of the conversations that we had was, and it's odd because, you know, we talked, she said, well, I said, well, you know, does that mean they have to bring it back to the health department? And I said, I don't know.
They don't have to, no.
Are there places they can drop them off?
Yes.
Are they easily known and accessible and convenient to folks? Because if we get complaints, you know, of needles being disposed of, let's just use an example, over behind the old hospital parking garage. And you know what I mean? And if there's
Walk
not
right
a,
across the street to McDonald's and put it in that sharp.
okay, and that's the answer I didn't have for that. And then the second is, how do you know whose is whose? Because when you go out, you know, are yours red and ones that aren't?
I don't know that ours are identifiable, are they? No.
No, but I can speak to the one that the officer was stuck with, was not ours, because I believe it had a
It was
blue.
a diabetic needle.
I don't know the answers to these, you know what I mean? I don't know the answer to that. All I want to make sure
But
of
that's
is.
part of the education when they're in the room, is they get Sharps containers and building that relationship and trust, and they tell them, please bring them back.
And I guess for me, you know, think of it in terms of an individual that is struggling, that may not have a significant care at that moment of use, you know what I mean? To take that responsibility and do that, you know, is it being discarded and to what degree? Because while I certainly appreciate and support the program, I also have a responsibility to make sure that folks in neighborhoods that I represent, you know what I mean, aren't receiving a negative byproduct of an otherwise good effort. And that's what I try to sort of have that conversation and communicate.
So I would say to that also that we have identified the need for additional, I guess, safe disposal sites as one of sort of the focal areas in moving forward. I know that I can't remember their name, but the grassroots harm reduction group. Yes, they, that's sort of at the top of their list, increasing safe disposal sites, and I think that, didn't it come to the council? at one
To
point?
add to that, there were several public entities, I'm not gonna say which ones, because they're backing off right now, but that were very willing to put sharps containers in their establishments for, they're kind of like high usage areas because of the negative attention that Delegate Parrott caused to this. All of them now are kind of going, we need to wait until this cools down, so
The good news
that
is
was
we're
a.
getting tons and tons
Yeah.
of syringes
Yeah.
after this.
And I guess,
There's-
and I guess,
But I do
well, that's
agree
where I
with you.
struggle a little bit
Right.
because, and I'm just gonna be real, I'm gonna be honest.
Go for it.
So, we have a creek cleanup coming up in September, she wants to do it, and I'm like, okay. And she's like, hey, so she's thinking of a way to create a container that, you know, when you're in the water, you're less stable and cautious, you know, so you wanna guide that into something, you know, and over the 15 years I've been doing it, we may have seen 3, you know, but so you have to weigh that,
Right.
whether to do it or not.
I would encourage.
You know
her
what I
to do-
mean?
I would encourage her to do a project.
Because you're like, you
No,
want
I
this
agree with
program
you.
to exist, and you want to be able to do those good things
Right.
at the same time.
And we do get calls, I mean, we obviously go out, but we also get calls for individuals. There was, I won't identify the street, but there was an individual that I've talked to 3 times, over the past probably 3 weeks. We've been out, we actually didn't find one syringe, it was at one of our housing areas. I think you went in and spoke with the maintenance individuals and, you know, because being real, we realize that there are syringes. I mean, regardless of whether they're ours or not, they come from our program or not, what can we do collectively? Again, from a
Gotta be
good program
responsive and
perspective,
responsible.
you know, from a responsive standpoint and a responsibility standpoint, what do we need to do? What areas or what gaps do we need to identify? And one is, as I mentioned, the increasing the safe disposal sites around the community. And I want to say, I can't remember how many we've taken back, but close to 60,000.
And one day we had a gentleman bring in close to 2,000. And just to expand on that, the layperson, the person who's going to different doctors and clinicians are calling saying, we don't even know what to do with
Yeah.
our syringes. Will you take them back? Sure. People who have loved ones that have died, they're like, do we just throw them in a garbage can or what do we do with them? So this has brought another level of awareness about somatic care. But since 2007, one of the first things we did was walk around downtown just looking for syringes and meeting store owners. We've gone to Long Meadow, the shopping center over here, and just let people know we're here. If you see a syringe, there was Julie Green did an article for us back in, I believe, 2017, that if you see a syringe, please don't pick it up. That was her motto. We'll come and get it. But unfortunately, when we do get the calls and we go out, we're not finding anything. So we don't know if it's that people are calling us because there's people using in that area,
I got you.
or what, we're just not finding them. But you know, if people see them again, please call us and let us know. We'll come and get them.
Okay.
All right, you want to talk about the coronavirus?
Do I have to? All right, quickly. Coronavirus, COVID-19. So, needless to say, and I think everybody realizes this, it's rapidly evolving. Probably what I'm gonna say now in numbers is already changed. I mean, it's literally hourly. But obviously, as the health department, we are sort of taking the lead role. We are working very closely with the Maryland Department of Health and our local and state partners. The numbers globally, a little over 116,000 confirmed cases, over 4,000 deaths in the U.S. As of 12 o'clock today when I looked, it's probably different. Over 647 confirmed cases and 28 deaths. Maryland has 6 confirmed cases and no deaths thus far. That could have changed. Again, this was at noon today, and I know, I think the governor was gonna hold another conference, press conference. In Washington County, we've had 0 confirmed cases thus far. From a disease severity standpoint, about 80% of the cases, confirmed cases, are really mild illness. So you have about 15 to 20% roughly that progress onto severe illnesses. At this point in time, and this is all early study and predominantly Chinese, the individuals in China that were confirmed cases have been the subject of early studies. So a lot of this data comes from there. But people over the age of 80 in particular, with underlying health conditions seem to be the hardest hit, along with younger individuals that also have health issues. They're at great risk. But the sort of the elderly population,
Hear that,
especially.
Lou? Wash your hands.
Yeah, especially, I'm not identifying anyone. Especially individuals with underlying health conditions seem to be the hardest hit. Surprisingly, and we don't really know why yet, but it doesn't seem to have a significant impact on kids, which is good, because kids are typically your greatest sort of germ harbinger. And so it would be gone like wildfire. Incubation period, about 98% of the individuals who develop the virus or come down with the virus show symptoms within 11 and a half days. That's similar to other coronaviruses like MERS and SARS. In comparison, the common cold's about 3 days and the flu is about 2 days. So you can see that 2-week recommendation for like self quarantine or self-isolation. You can see where that comes from. A basic reproduction number is sort of virology speak for how contagious is a virus. And when you get down to like a virus is like extinguishing itself or going away, that number is typically below 1. And that really is the number of individuals that one individual infects. Coronavirus is early on 2.2 to 3. And if you look at the common cold, it's about 1.5 or 2. So you can see the infectious nature of the virus. Governor Hogan's declared a state of emergency, and our efforts continue to be on containment. And at this point in time, it's not necessarily containment to like, we'll contain it here and it won't get out. We're seeing evidence around the country of community spread. So a lot of the containment efforts at this point are really to slow the spread of the disease. The next phase that we would get in from a public health perspective would be to get into non-pharmaceutical interventions, namely community interventions, which would be social distancing, canceling gatherings, any sort of school outbreaks, or canceling, postponing school altogether. So you would see those types of things come along in the next phase. I do know that the governor is beginning to talk about those things. I know this afternoon he announced that he's encouraging the university systems post-spring break to do like remote education for 2 weeks as we progress through this. And he has also indicated that, hasn't said it's mandated or it's recommended, to start planning for those types of interventions. But we are not there yet. The risk in Washington County is still low. It's no time to panic. The greatest thing that we can do now is, instead of panicking, is to prepare and plan. Some of the things that we're doing at the health department is we're on frequent, and I mean frequent, conference calls with CDC, Department of Health, other state partners like MEMA and MIMS. One of the biggies that we have done is we've established a unified coronavirus task force of all critical partners and stakeholders in the community. I know some of you are on that and get updates regarding that Wednesday mornings at 8:30 at the health department. And it's really looking at coordinating information that goes out to the public so that we're all speaking one voice and all speaking in repetition, so to speak, so it sinks in with individuals. We're identifying any gaps. We have robust plans, but that's not to say that there still aren't gaps in those plans. I mean, plans are constantly in motion and sort of fluid in nature. We are establishing plans to ensure that first responders and the healthcare system, the individuals that we're going to rely on to come treat us and get us to the healthcare system, we're looking at ensuring their health and safety so that we don't have any shortages in the workforce in those two areas, and also, and probably most importantly, to address the identified resource needs, and in particular, the PPEs, N95s, all those good things. So we continue to work very closely with all sectors of the community. The business community, we're working with the chamber, we're working with higher ed, we're working with the school system, across the whole sector. So one of the big things is, especially from a response perspective, is not to panic, but to be prepared and plan. Again, we have robust plans in place. It's not just the health department as a response entity, it's collectively all of us moving forward. I would say that especially since we are looking at moving into community mitigation, it's really a collective responsibility of everyone. We can have the best response plans, you know, the best responders, the best healthcare individuals, or public health individuals in the world, but if we all aren't doing our collective best to wash our hands, cover our cough, you know, discard the tissue that you coughed into, don't shake hands. If we aren't doing those types of community measures, we will still probably see community spread once we see it, and if we see it in Washington County. So it is imperative among everyone to take prevention seriously. And I know there are people who are like, it's a hoax, or we need to take it seriously. We don't need to panic. We don't need to be overly concerned, but we do need to take it seriously. You know, the World Health Organization has set the fatality rate percentage at about 3.4. Flu is about 1%. I think that you'll see that come down a bit once we get a handle on the estimated numbers of individuals who just didn't seek care. A lot of that is off of numbers from China and individuals that were confirmed cases. There's strong suspicion that there are a lot of individuals who may be asymptomatic or just had mild symptoms, maybe had a headache, maybe had a little fever, never sought care, we didn't know anything about it. So I think once we start seeing the numbers, the estimated numbers of individuals who just didn't seek care, didn't know they have it, I think that fatality percentage will come down. But we still need to take it seriously, because the communicability of it is greater than the flu, because that's another thing you hear, where it's not worse than the flu. You can catch it quicker than the flu. You know, the symptoms for individuals who have underlying comorbidities are a lot more significant than the flu. So with that, again, it is prepare, don't panic, plan, don't panic. And again, it's a fluid situation. We're rolling along literally from hour to hour. But again, we have robust plans, and we're all coordinated and moving forward together in Washington County and in Hagerstown. And I feel really, really good about that.
Good.
Did I miss anything, Doctor?
Stay home when you're sick.
Stay home when you're sick. That's a biggie too. Don't send your kids to school when you're sick, when they're sick. So that's my message for the day.
Is it, as we spoke last Wednesday at the meeting at the health department, is there, is the directive still, if you think you are coming down with it, don't show up at the ER, don't show up at Meritus, call your physician?
Call your physician. They are coordinating with us. There are, I don't want to steal your thunder, but there are testing parameters that are in place. We typically, we had calls all weekend, but from Meritus in particular, and also from private physicians. But yes, if you feel as though you're coming down with something, don't rush out to your healthcare provider or the emergency room unless you're having significant difficulty. If you're having shortness of breath or anything that could be life-threatening, certainly you want to go ahead and make that call. But if you can, call ahead and let them know that you'll be coming in.
Anything else? Earl?
I'll just add on, as far as the city is concerned, from the press conference that we had yesterday, what the city is doing. Dawn Francis, Chief Kiefer, and Chief Lohr are all on the task force that the health department has put together. We sent out an email to all staff last week regarding steps they can take to just the common sense stuff that you can do to prevent the acquiring or spreading of the virus. We'll meet tomorrow afternoon with the management team to go over a draft pandemic emergency plan that Dawn has put together. This will address mainly how do we maintain critical services should we find that we end up having employees that aren't coming to work. Looking at the various departments' contingency plans for that, which were originally created more looking at blizzards and floods and tornadoes, but can be applied just as easily to this. And then we'll come together and continue to communicate to staff as we receive information from the health department. We're relying on the health department right now for the information as the one channel of a conduit of information that we'll send out to staff. Also on our city website, we have a link now on COVID-19 information that links to the CDC and to the Maryland State Health Authorities for information there that if anyone is wondering where they can get up-to-date, true, factual information, that's where they can go.
I got a phone call yesterday morning at about 9:15 from the director out of Philadelphia, who is in charge of 4-state region and DC. Sung your praise. Let him know that you guys had held the press conference yesterday, and yeah, so
Thank you.
I say as of right now, we're doing fine. We have great leadership in place to handle this, and you know, we're gonna wash our hands a lot.
You are gonna watch it.
Cough into our elbows
Don't
and
touch
do
your
that kind of
face. I know
stuff,
it's
yeah.
difficult.
So,
You know, I shared with Earl privately, and I want to say it, there are many of us who watch the national news and have very little faith in our federal government, without even talking about all the reasons why and personalities. But, you know, when it comes to your roads, when it comes to things like that, you don't look to the federal government. And we have people that we can trust, that are competent, that are trustworthy, from right with our city administrator to our local health department to our state government. And when we're looking for that safety and when we're looking to be able to trust, we have that in place. And I just want to commend the health department. I've seen the things between you all and Meredith, and we're, as a community, doing everything we can do as a community to be ready for this. And let's hope it's not nearly as bad as we're afraid it is, but as I just shared with Earl, he's right, the numbers just keep going up as we're sitting here today. The deaths have gone up to at least 30 now in the United States, and we'll be surpassing 1,000 very quickly on the infected. So I thank you all for everything you're doing.
Thank you. We appreciate it.
okay, thank you guys very much.
Thank you. We
Yep,
appreciate
thanks for the
it. Thank you.
updates on both, yep. Proposed revision to the Hagerstown Code of Ethics. Mr. Brickner, good to see you, Mayor. Again.
Thank you.
It doesn't seem like it, but the last time the Ethics Commission met with council was in November of 2018, which was a good while ago. Since that time, one of the items that was discussed at that meeting was legal services. And legal services normally were represented by the city attorney, who attends all our meetings, except we realize that there may be, or there incidents where there's, the city attorney has a conflict, or in some cases, and so the question is, what does the Ethics Commission do for legal services? I believe you all indicated that at the time you would consider some changes, some addition in that. After several meetings, we did come up with looking at the city's Human Relations Commission. It had a clause in there regarding legal services, and we felt that would be a very appropriate if we could make that change, that addition to our ethics ordinance.
So, and I believe we've had to, we have submitted that, I believe, to the Ethics Commission to see what they felt about it, and there's an indication that that wording would be acceptable, or that clause would be acceptable.
State Ethics Commission,
Big pardon?
the State Ethics Commission.
Yes. So, with the assistance of our city attorney, who's been very helpful in this area, we've come up with a item 35-5, which is conflict of interest, which I think you've all had I hope you've had an opportunity to review it.
Yep.
Yep.
Everybody okay with that?
Yeah, I think that's, makes all kinds of sense, that if there is a conflict like that, you need, we can't, I think we talked about that before, we can't have the city attorney represent two
Both.
parties.
Yeah.
Right. And when, I think there's very seldom, we hope, there's very few
Hopefully never,
occasions
yeah.
when that would be necessary. But at that time, when that happens, we would rely on the city attorney to assist us in finding counsel as well.
I have no objections to
Thank you.
that. Thank you.
Good to see you.
Thank you
Thank you,
very
Bill.
much. Nice to be seen. Beautiful day. I thought we'd be out of here a lot earlier so you could get out and enjoy the rain.
Well, Krista had some questions to ask.
So,
Yeah, that goes.
you
City
very
Administrator, anything from you?
I got a couple things, Mayor. First, I want to apologize for the confusion from last week on the letter of support for the House bill on the change in hotel motel tax. I would just like to get a final yes or no as to whether this letter, whether to keep the letter of support or to have it withdrawn. I did speak to the delegate. The delegate's not doing anything with it. I did explain to him the desire to have MML approached and to have a joint MML support letter if MML was inclined to do that. He said he thought that was a good idea. Whether he's gonna do it or not, I don't know. I would just like to know if there is support from you to maintain that letter, specifically from the city, or to not.
Show of hands and support.
Supporting the letter.
Supporting the letter, right,
Without
that we, right.
MML.
Right, our letter to the, right, supporting it.
Well, I think that we were talking about like getting that support and doing a
So
joint
there's
letter.
still
but that
confusion.
was-
Then
Right.
that's
I thought we were
fine.
going to hear what the CDB's position was, and if the delegation, I thought we were gonna get a report back to say, delegation reviewed it, here's where they stand. CVB has deliberated as an entity, here's where they stand, and we have confirmation that our delegate asked X, Y, and Z, and then we were going to communicate to the chapter at their next meeting. I thought when we talked, somebody said, well, when's their next meeting? And we were
Next
going
one.
to communicate to them and that we would be a party
Monday.
to the decision of the municipality as a whole.
And that was where it was left Tuesday. And then Wednesday, there was a third that expressed support for a letter. So that's,
I think the question is, are we going to send a letter of support before we get the letter of support from MML? Are we waiting to hear from MML and
Right, and
then writing a letter of support? I think
for me, I thought it was integral to hear from those bodies such as CVB, the delegation, MML, who are directly impacted, frankly, as well as the county. I mean, part of the impetus of this is because it was to remove the politics because of the difficulty of city and county being able to cooperatively advance the ball on big projects. And if we come out and sign this letter and the county commissioners come out and say, we're absolutely opposed, I'm not, how has that removed the politics or the ability to coordinate and cooperate between those two bodies that it's citing, it's supposed to be addressing that issue of? That, it doesn't make a lot of sense.
Okay.
And Delegate Quarterman did agree that a joint letter would be a good idea.
Yes.
Correct?
He did.
Okay, here's where I think I'm a little bit confused.
Okay, so the next meeting of MML is the end of this month. Session ends April, what? 13th, 14th, something like that.
I thought the next meeting was Monday.
2 Mondays.
Two Mondays from now.
Mondays.
Yeah.
Oh, the end of this, I'm
End of
sorry.
this month.
I thought it was this, I'm sorry.
I mean,
23rd.
I think it's a little odd to me, I think we read in the newspaper last week, right? It was last week, Wednesday? Literally a day after we had our meeting, where the delegation deliberated on a fairly minor item, the zoning.
The zoning.
Before you get your, the commissioners say, hey, we want this. I mean, here's an instance where an actual local body has said to its delegation, hey, we want this. So somebody sponsors it, you know what I mean, puts it forward. Delegation deliberates and takes a position. I think it was 3-2, 2 opposed, 3 in favor. I'm just curious if the delegation, I'm assuming, I don't know how all that works, that they deliberate on each of the bills that they submit or that individual members of that entity submit, if they've deliberated as a body and formulated a position as a body, just like we do here, on that particular bill.
So we should wait until the county decides.
Not the county, I said the delegation.
Oh, well,
The delegation.
but I heard you earlier in your comments, just a minute and a half ago, say that if the county doesn't support this,
No.
then,
No, I never said that. Never said that. I said that the impetus for this, as stated in the paper, was to remove the politics because the city and county can't get along to accomplish big projects like this in a manageable time frame, which is why we're going to
Did he
cheat.
not say if the county doesn't?
That, I mean, that's exactly what was stated in the paper. And all I'm saying is, I mean, let's not be naive. All of us know that 2 members of the county body sent something to the state and said, hey, we haven't deliberated on this, we haven't taken a position, we're opposed until we actually do that. All I'm saying is, if you've got a body that comes out and says no, and then this body has already said yes, a body that has nothing to do with the bill, didn't ask for the bill, and then you have these dominoes that fall, let's say the county says as a body no, and the delegation as a body says no, and the CVB as a body says no, and we're the only ones that have said yes to a bill we never even asked for that has no impact on our deliberations, then everybody gets to say, see, it's the city that wanted this. Well, heck, we didn't even know it was happening until it was actually already submitted. I don't know how we could then be perceived as the entity wanting it unless we're the only entity that says yes before any of those other entities deliberate. And I have no idea in my mind why none of those other entities that it directly impacts, that have clearly had private conversations about it, haven't simply taken a position.
Yeah, I don't know. Couldn't answer that.
Well, I think politics are certainly at play on that.
Anything else?
I do. Well, no, I'm gonna make sure. So that letter stays as a basically no support letter right now. We're not providing support for that bill as of right now, as the city of Hagerstown.
Correct. I think that's correct.
That's
Correct.
correct.
Until we
That's
hear from-
correct.
hear
Okay.
From all the other parties.
So there, okay, that's 3.
So are we going to ask MML if we can address this?
We're not gonna, I left out, well, let me just say, I told the delegate, it's the delegate's bill. It's him asking for support. I don't think it's, he should be the one that asks. I don't think it should be us asking MML if they support. I think the delegate should be the one going to MML and asking for all of the cities to be on a letter and sign off on it.
Get local with that. We couldn't even agree on how to disperse hotel motel money that the county was giving us. How in the hell are you gonna agree to something
I
like
don't
this?
know. Why isn't the delegation deliberated and taken a position? They have on all the other bills that the delegation has submitted.
Yeah.
That just
Buddy, I
doesn't
don't
make any
know. I wouldn't
sense to
tell
me.
you. I
Yeah.
don't have an answer for that.
Or
I wish I had the
CVB saying to the
answers.
newspaper, well,
Yeah.
our membership hasn't met to deliberate on this yet. Clearly, the public is not that dumb that they don't believe that all of those entities in different factions of the
Have not
parties that
had a
make up
conversation.
membership of the CVB
Right.
have had conversations.
Right.
Just
Okay, so there's
take
no
position.
support to this. Let's
Okay.
move on, please. I want to get out of here.
Okay, I got about
But no.
6 other things. The last thing I have is the ask for support from Brooke Grossman of Goodwill related to the application of Goodwill for an ARC Power grant. I know some of you had questions about that. I know she had sent emails back to address. I don't know if it was enough for you all to want to offer a letter of support for them to get this grant for this freight service to have offices downtown. If you have any questions, she's willing to come talk to you about it. If you're willing to do that, leave that up to you all.
I'm fine with the letter of support.
Has the county offered a letter of support? I just need to know these things, don't we?
I would certainly like more information.
Me too.
I was gonna save this for my comments tonight, but I'll just make the comment now, and I'll shut up when it's my turn. I think we seem to be getting more and more requests for letters of support, and I think that we should consider making a rule that if someone wants a letter of support, they should come before the council and lay out all the reasons why, so we can deliberate in public. I don't think we should be deciding via emails back and forth, are we gonna support something or not support something? It should be in public session, and the parties that want the letter of support should get on the agenda and come and make a presentation to the council so we can deliberate about it and decide if we want to do it, yes or no, or if we need more information. In your case, as you were saying, if we need the CVB to come here and sit and tell us what the impact is going to be on them. But to have this stuff hit where, there's no time to wait until the next council meeting to deliberate on this, because there's some kind of an immediate need for a letter of support, and we need to,
I think we're getting, obviously with the legislature in session, I think we're getting a lot of those. I think that the motivation obviously is to have a discussion in open session. Some of these are are fairly straightforward. This one is more involved, there's no doubt about it, and certainly looking through there are questions that need to be asked, which is why I asked her if you had an opportunity to explain the program in front of mayor and council to get their support. Would you be willing to do that? She said absolutely. I don't know that, certainly it's better than email, than doing this through email. So I'm up to whatever works best for you all when we get these. And I expect them to decrease certainly with the session dying down. But I just look to you all. I would much rather, the more we can do this in open session and everyone know what it is you all are supporting, the better off we'll be. You'll be.
Do we put these now, like, let's just take this particular request. Does anybody but us have that?
I don't know.
Did you provide it to the press?
No, I
Like,
did
that to me is a
not.
little odd that we would do it right at the end. We haven't provided the press even a copy of the letter.
Is the letter.
Yeah, and you know what I mean, nobody sees it but us. So I don't know that in every instance, we need somebody to come in and explain it out. But at minimum, if we're going to
Needs to be an
take a
agenda
position,
item,
yeah,
not discussed
even if
in
it takes,
council
I mean, heck, there's tons of stuff staff brings, it takes us 2 seconds to say yes.
That's
You know,
fine.
Sounds great.
If
We
I-
should at least have it that way to say, yes, that's great.
Perfect. That works perfect for me. Yep. Happy to do that. That's all for me.
Cool, Sharon.
I don't have anything tonight.
Lou,
Nothing tonight, thank you.
You're not allowed.
I promise to shut up.
Kristen.
I'm with Austin.
Oh, cool. All right. Grand opening day at Glitz and Glam down at 50 East Franklin Street. A nice couple, a family, basically, moved from New York to Rockville, spent several years in Rockville, moved from Rockville to here, opened up, right now, it's 2 businesses. said, oh, well, I just set my alarm. He said, no, you just set it off. You didn't just set it. So, anyway, congratulations to them. If you get a chance, stop down 50 East Franklin Street. It's a nice little shop. And it was great to meet them. They're a great family.
Also, I'm sorry, also real quick, congratulations Darren Brooks.
Yes.
Big Ten
Yes,
wrestling
my guy,
champion,
Jay.
North High.
Yep.
So congratulations from a South High to a North Higher. I watched that match, and I saw several of his matches, and as a true freshman, he is a heck of a wrestler. So congratulations to him.
He'll be holding his titles for a while. All right, we're adjourned. Thank you.